Just a brief
Yes.
introduction about me. I'm working as professor in National Institute of Ayurveda, where there is UG, PG, PhD studies, and also nursing studies in the field of Ayurveda. So I have 24 years of teaching experience to PGs, then UG students, and also 10 years for PhD studies. So I have my own YouTube channel wherein you can watch all the success stories of my case series, which I have done in many patients which were not treated by modern people. So these are some of my achievements. Like I was a resource person for at least 40 paper presentations, and I have chaired many scientific sessions, and I was a keynote speaker for more than 5 presentations, and I was also a judge for evaluating scientific paper sessions in national and international conferences. And during COVID times, I have done many topics on different aspects as a resource person, and I have 75 papers published in different works, and also in research gates I have put many of my papers. And I am the author of two books. One is on concept of glaucoma, and other is understanding of nasal diseases in Ayurveda. So I have guided more than 38 research works in for PG students, and 10 for PhD students, and also co-guide for many of my students. So this is our National Institute of Ayurveda, which is located in Jaipur, and it comes under the Ministry of Ayush. So it is. I have a lot of successful stories. So this is a very nice case which I would like to discuss on diplopia. And so, first and foremost, let us know what is diplopia. So, it is the simultaneous perception of two images of a single object. So, this is a common condition which is usually found in the elderly. And when we look into the causes of diplopia, they are manifold. So, we have to first ascertain whether it is due to ocular causes or it is neurological cause, and also on the type of diplopia, whether it is horizontal or oblique or vertical, that we have to find out. And also we have to see whether the diplopia is monocular or binocular, that is it is seen only through one eye, or when both the eyes are open, there is persistence of diplopia. And whenever we see monocular diplopia, we have the cause is usually due to ocular, and that is why we have to rule out all the examinations like slit lamp, refraction, etc. And whenever there is binocular diplopia, the cause is usually neurological. And also when we are looking into diplopia, we have to see the history whether it is of acute onset or chronic onset. And whenever it is of acute onset, it is mainly because of this vascular causes. And so looking into the causes for diplopia, so we have a list we have to identify whether the lesion is in the supranuclear area or the nuclear, that is for binocular diplopia, whether it is nuclear or internuclear or infranuclear, or it is due to myopathic or restrictive or orbital. So that cause has to be ruled out. And whenever we are looking into orbital diplopia, we have to also look into the ocular causes, like if there is subluxated lens in the anterior chamber, or a subluxated IOL, that is the intraocular lens, or there is a incipient cataract or keratoconus, etc. And whenever there is binocular diplopia, we have to always look into the if there is any paralysis of the extraocular muscles, or a displacement of one eyeball in space occupying lesions of the orbit, or anisometropia, or if there is it is due to myasthenia gravis. So these are the list of causes. Like whenever we think of monocular, we have to look into whether it is repetitive image or ghosting type of image. Again, depending upon the if it is a repetitive, there may be cerebral, it may be due to cerebral polyopia. Or if it is a ghosting type of image, it is whether it is it improves with blinking or with pinhole, or whether it doesn't improve with blinking or pinhole. Because blinking or pinhole, for the cause is usually refractive errors, and if it does not improve with pinhole, then it is usually retinal, so that we have to ascertain. And when it comes to binocular diplopia, we have to see the alignment of both the eyes by using cover test, and we have to see whether there is misalignment. And if there is misalignment, then we have to see whether it is due to concomitant strabismus or squint, or it is incompetent strabismus. And if it is committent strabismus, usually it will persist since childhood, or it may be acquired. And if it is concomitant strabismus, it may be due to restrictive or cranial or supracranial lesions. So this has to be, or sometimes it may be neuromuscular junction disorders. So this has to be ruled out. And when it comes to this when there is no misalignment, then we have to see whether the quality of image, how it is, whether it is similar or dissimilar. If it is dissimilar image, it may be due to macular diseases or a marked refractive asymmetry like astigmatism, etc. And if it is similar images, we have to see whether the image is constantly present, diplopia, it is constantly present, or it is intermittently present. And if it is constantly present, it may be physiologic or non-organic. And if it is intermittently present, it may be due to myasthenia gravis or decompensating phonia or so here, I'd just to like to give a brief this thing introduction about Arnold-Chiari type 1 malformation. So usually these group of deformities are present due to any deformity in the posterior cranial fossa or the hindbrain, and usually there will be cerebral tonsillar herniation, especially through the foramen magnum. And sometimes there will be absence of the cerebellum with or without associated intracranial or extracranial defects like hydrocephalus, and usually this is congenital. So in Chari malformation, you have to also rule out whether the bones of the skull are underdeveloped, whether the volume of the is inadequate to contain the entire cerebellum, or the cerebral tonsils are displaced through the foramen magnum, or there are any cerebellar signs like ataxia, dysmetria, or nystagmus, or any cranial nerve deficits that has to be ruled out. And if it is due to direct compression of the cerebellum or medulla, you have to see it at the level of the foramen magnum. So this management of diplopia is usually very complicated. It depends upon the type of cause, and if the cause is identified, you can easily well manage. Usually ocular causes, if they are known, it can be easily managed when it comes to neurological causes. And when it is usually involving any cerebral tonsillar herniation or any other defect, then it will be usually we have to go for surgical management, which is often very complicated, and the patient may also risk his life if it is not done properly. So this case is also a very interesting case, and the patient approached the alternative therapies when he could not get the cure in modern science. So here the patient had visited multiple institutions, like he told he has visited more than 50 hospitals of reputed fame like AIMS Delhi, AIMS Bhopal, etc. But he could not get any relief. But after the patient was so depressed that he was sitting in home and not doing any work, because whatever he sees, it will be two images, and even he could not eat properly nor walk because the floor was also upside down. So really he was very depressed, and when someone informed him about our hospital here and about me giving treatment successfully for many diseases, and that's why he approached our hospital. And the first thing what I did for this patient was he needed counseling. So I had to give him some faith, because he has visited multiple institutions and hospitals wherein they have not given him any faith that he will be cured of this problem. So first thing I did was counseling and gave him some hope that we can cure this condition. And you can see the patient's records also. So here interesting facts I would like to highlight is the MRI which was done on 3rd to 2021. Here there was herniation of the cerebral tonsils for a length of 13.6 mm on left posterior side and 11.9 mm on the right posterior side of upper cervical cord, especially at the level of the foramen magnum. And he was diagnosed as a case of diplopia due to cerebral tonsils herniation causing the Arnold-Chiari type 1 malformation. And this CSF flow study was also done on the same date, and it shows normal phasic variation of CSF and flow in anterior subarachnoid space. And we can also see that the posterior subarachnoid space was effaced at the level of foramen magnum. And so the doctors they gave him the prognosis that we cannot treat this condition, and surgery was very complicated to him. He may risk his life. So this was the patient who approached from Gwalior, and he's 46, 44 years old male patient. He had a history of diabetes and hypertension since 10 years, and he was under medication. And the problem of diplopia arise suddenly, so it was of acute onset. Suddenly the patient started getting a double image, and he and this slowly progressed. So the patient got admitted in AIMS because he was from Gwalior. He got admitted in AIMS Gwalior, and he was admitted in emergency for 1 month. And all the investigations were done, but there was no relief, and the blurring of vision also persisted, and there was also had history of headache, and it was progressive in nature. So the type of diplopia here was binocular, that is, when he saw with one eye, he could see a single image. But when he saw with both eyes, the image was double, and also the it was a horizontal image. And on whenever we when we examined the ophthalmic examination, so there was bilateral rectal paresis, and there was head posture and facial asymmetry was normal, and the pupils were also normal and normally reacting to light, and there was no evidence of ptosis, and the findings in slit lamp, then fundus were normal, and the IOP was 16 MB in both eyes. So in this way, the vision of the patient when it was examined, it was 6 by 24 without glass in right and left eye, and with the best corrected visual acuity, it came to around 6 by 12. And this thing was near vision was normal in both the eyes, and the patient had trichromic color vision. So this was the case sheet of the patient who came to our hospital. So I have admitted this patient and I have given all the treatment because he was a native of Gwalior. So in this way, the patient took 3 sittings of the treatment, and I will be discussing about the various treatments. And you can see the this thing MRI and the CSF flow analysis in this report, which is showing cerebral tonsillar herniation, and it is suggesting of the Arnold Chiari type 1 malformation. So the treatment started was about the different, it was multiple or multi-dimensional treatment. And first we started with internal medicines, and then we gave him some therapies and eye massage. Then there was special therapy for the eye, and I will be discussing the treatments in my next slides. So this therapy started with the Nasya Karma. So this Nasya Karma is a very important drug delivery system, which is mentioned in Ayurveda, which says that the nasal drug will reach the higher centers in the brain. That, as they say, that nose is the doorway to the head disorders. So that is why, and even for correcting any, this nose is connected to the different pathways which are linked to the different sense organs, so that is the eye, ear, nose, throat, etc. So that is why it is a very important therapy, so for all the diseases which are located above the clavicle. And the drug delivery system here, whatever drug we administer in the nose, it will reach higher centers in the brain, like the olfactory, the limbic, the other centers, and hypoglossal also, and pituitary. So that is why it is a very important therapy. So this therapy is one doorway to refresh the nerve endings, or it is neuroprotective, and also it will clear the vascular anomalies, by because here whatever medicine we choose, so that will bring about the effect in different diseases. So this is the mode of action, how it is going to stimulate the vital centers in the brain, and also it will be nourishing the tissues, and it will also do shrota shodhan, that is, it will clarify the channels. So you see that whatever medicine we apply in the nose, it will reach the cavernous sinus through the facial vein, which is a branch of the angular vein, and from the facial vein it will directly drain into the cavernous sinus. So in cavernous sinus we have the optic nerve, then we have the other the oculomotor nerve, then the sixth nerve, the abducent nerve, etc. So it will directly nourish these nerves, and also we know that any infection in the cavernous sinus, it will give rise to meningitis, etc. So in that way, any infection in the anterior part of the nose, that is in the vestibule as well as the upper lip, has the tendency to reach the cavernous sinus. So in the same way, whatever medicine we apply in the nose will also reach this centers. So that was my this thing, and that's how our medicine has acted. So whenever we are doing nasya therapy, it is very important for us to select the right drug. So because based on the pathogenesis and based on the doshic vitiation, we have to select the particular drugs which will show its effect in different conditions. So in this study, case study, I have used these two drugs for intranasal drug delivery. So one is Vacha. So this Vacha, it is considered to be, because already it is a proven result about the role of Vacha in neurological and metabolic disorders. So this study has already been conducted. So it is also having the capacity to do Shrota Shodhan, that is, it will cleanse the Srotas. So wherever there is any blockage, it will help in removing that sort of blockage. And also there is integration of antioxidant defense, then GABAergic transmission, and brain stress hormone modulation is also present in Vacha. And there are so many new studies done in this about this drug, and it is considered to be one of the powerful drug which will be very effective. Along with Vacha, equal quantity of Pipali, that is Piper longum, sorry, Piper longum is used here. And so this is also a wonderful drug. It is also considered to be anti-cancer, antioxidant, hepatoprotective, and inflammatory. And it will reduce the inflammation which wherever it is present in the body. And so this, even though it appears very tikshna, or it was very irritant, but we have administered these two drugs for getting this effect of Shrota Shodhan, and also making this, because it is having very fine particles, it will help in traversing to different sections of the brain. And here whenever we do this nasya therapy, we first prepare the patient. We will do this abhyang to the face, and this abhyang, it has the effect of vasodilatation, so that whenever there is vasodilatation, whatever medicine is put into the nose, it will be absorbed in a better way. And the head low position of the done during installation of this drug into the nose will also serve as the penetrating this drug indirectly into the different parts of the brain. And because it will be very tikshna, so that's why it has the penetrating power. And also after this nasya, we make the patient lie down for 100 matra kalas, that is for around 5 to 10 seconds. And after that we try to put the steam inhale. We give steam inhalation usually, which is of aromatic substances. So these aromatic substances act as a prodrug, and it will carry the fine particles of this drug into the nervous system, that is through the olfactory route. Because you know that the olfactory nerve terminals are entering into the roof of the nasal cavity, and there are around 20 to 40 perforations in the uh, roof of the nasal cavity, through which this olfactory nerve terminals will proceed to the brain. So in that way, through this mode, it will reach the thalamus, the hypothalamus, the and the limbic system, and as well as the pituitary, and thereby it will correct the, and also it will, through the facial vein, it will also reach the cavernous sinus. So in that way, it has a multifactorial approach, and based on its content, it has given very good result. And along with this nasya, we have also done a special therapy called netra parishek. So this therapy will and help in soothing the nerve endings in the eyes especially, and this will be enhance the eyesight, and it will also counter the fatigue, the stress, etc. And after doing this therapy, the patient feels nourished. So this is a preparatory therapy for the next therapy which we are going to conduct, and this that is the tarpan. So we have to wash the eyes properly, and we, so that there is no inflammation, and also the toxins, etc., are relieved, because we have to prepare the eye for the next procedure. And there will be vasodilatation, so that during tarpan, the eye can properly absorb whatever important drugs are put into the eye. And along with this, we have also done Shiro Basti. So Shiro Basti is, I mean, Shiro Pichu. Here we have done Shiro Pichu, because Pichu is keeping cotton wool soaked with medicated oil. So this will also help in improving the circulation to the brain, and it will also rectify the neurological symptoms which are caused by intracranial or extracranial vasoconstriction or any other vaso dilatation or any other vascular pathology. And it will also be relieve stress in the patient, and it is very helpful especially in neurological disorders like paralysis and facial palsy. So these three therapies were done simultaneously, and you see that this therapy is very helpful especially for stimulating the nervous system disorders, and it will also improve the vision, and it has a multifactorial approach in different conditions, and it will also de-stress the patient. So the next therapy what we put, this was done for 7 days, and next therapy what we did was the tarpan therapy or the nourishing therapy. So here the medicine which was used is medicated ghee. So in this patient we have used Jeevantyadi ghee, which is very good neuroprotective element, which is helpful in management of this nervous disorders. So here we have used this ghee in the form of retaining the ghee inside the eye for a specified period, and in order to retain this eye we have used this this paste of marsha paste. And in order to retain the temperature of the ghee, because it was retained at more near body temperature, around 37 degree centigrade, and in order to, because the ghee, if it will solidify if it mixes with cold air, so that's why we have maintained the temperature by covering with a leaf. And this therapy it was done continuously for 7 days. And during this therapy there are some restrictions that we should not go out in the sun or avoid dusty particles, and we should not overuse our eyes. We should give rest to the eyes after doing this therapy. This was done usually for 20 minutes, and after that we give complete relief or complete rest to the eyes by packing the eyes with this flowers of jati, that is the or we can use lotus flowers or any petals of the rose, etc., to cover the eyes for 1 hour, because that effect can be gained only during that time. And after this therapy, there is one more therapy called Puttapaka. So this Puttapaka is considered to be a nanotherapy in eye diseases, because the method in which we prepare this medicine, it is having animal medicines which are of animal origin, then the plant origin, and also from this mineral origin. So all these are mixed together and made into the form of a ball, and it is covered with leaves that which are very good for the eyes, and then made into a mud pack is prepared, and this is incinerated for half an hour. And after that we remove the coatings and we extract the juice. So this juice which is extracted, it is having the fine particles of the drug in the form of nano form, which are very fine, and which will have the capacity to penetrate inside the eye. And usually this therapy has to be done only after tarpana therapy, and we cannot do before that, so in order to enhance the vision better. So here we have used meat and drugs like amla, then ht, and shatavari and guduchi, as well as aloe vera, and some amount of ghee is also added, and some bhasmas like shankha bhasma and kapardik bhasma, that is calcium preparation. All this is added in order to, and this extract was used in the eye for another 7 days. So after this therapy, the patient was taught about the eye exercises. Simultaneously, he can also do the eye exercises, which will help in restoring the vision, improving the, or correcting the refractive errors, and it will also relieves in symptoms like headache, watering, eye strain, etc., because it will relax the mind as well as the vision. So these are the series of exercises which have to be done. So first it starts with the washing of the eyes with using eye cups, and here we use Triphala, HT, and all the drugs which are good for the eyes. After this eye wash, we have to go put eye drops in the eyes, and with the patient has to be exposed to the sun, and the sunning exercise, it is very helpful. It will indirectly we are gaining the sun's energy, and that is also it will stimulate the photoreceptors, and thereby it is very important therapy. Running exercise is followed by palming exercise, wherein we rub the fist, the hands, and we keep it over the eyes. And after the palming exercise, these are the therapies. So this is the eye wash, then palming exercise, then followed by sunning exercise, and then candle exercises, then this ball exercise and bar swinging exercise, finally followed by cold pad. So in this way, this sequence of exercise have to be followed. It is this candle is concentration, which will improve the central fixation, and especially it is very helpful in cataract, presbyopia, glaucoma, etc., and also some degenerative diseases. And we have also used some neuroprotective drugs which were given internally. So here Shirabala 101 is a very important medicine which is easily available. So this was used, capsule is also available, and oil is available. So capsule was used, two capsules twice daily were used in this patient, and along with that we have made a powder combination of some important drugs like Shatavari, that is asparagus, racemosus, then ashwagandha, Vithemia somnifera. As well as the bhasmas like shankha, kapardika, etc. So these drugs, they have the asparagus, racemosus, that is Shatavari. It has neuroprotective effect, and it is used in many of the this brain disorder. So this drug was used, and it already some animal experimentations have also been done in this. And Shankabhasma, it is conch shell. It is considered to be a form of nanoparticles, and it will act as a pro drug, and it will help in carrying the biomolecules of the other drugs also to the different parts. And so here Pravala Bhasma and Shankar Bhasma, those are also natural sources rich in calcium, and these were used in along with the Shatavari and the Ashwagandha, and it was given in the dosage of 1 teaspoon twice daily for this 2 times with milk. So in first follow-up, that was on 3/7/2021, the patient vision was 612, and in right eye and in left eye also it was 612, and there was 30% relief in diplopia. And then the patient, after giving a gap of 1 month, he was called for second sitting. So in second sitting, here Nasya first was, which was Shodhana Nasya, was now given with Shirabala 101, which is neuroprotective drug. So here after Shodhana we have to go for directly doing neuroprotection. So that's why this drug was used. And then the same process of Netra Parishek, that is eye wash, was done with Triphala HT, Lodra, and other drugs which are good for the eyes. And here Tarpan, again after this 7 days of treatment, again Shiropichu was also done here, and these three procedures will done simultaneously, then followed by Tarpan and Ropan Putapak, what I have mentioned. And here Shirodhara was also done, especially. So Shirodhara is a very important technique. And here the drugs like the Shamula oil, then Ashwagandha Bala Lakshadi oil were used for Shirodhara, that is for 45 minutes daily for a period of 14 days. But this process cannot be clubbed with Tarpan or Nasya, so it has to be done individually. And along with that, the same internal medicines which were used previously were also continued. So this was about the second sitting. So at the end of second sitting, there was improvement in vision, was 6/6 in both the eyes, and along with that IX is also, were also done simultaneously, and the diplopia was reduced to about 70%. Then on 14/9/2022, the last this thing follow up was done. The same course was repeated for the third time, and the vision during this time it came to 6/6, and the patient had no diplopia. And some follow-up medications like falatriquat, that is trifaladiquat, neuroprotective powder, what I have mentioned, and the same was given as pratimarshanasya, that is 2 drops of Shirabala 101 were given to the patient. And the MRI was again repeated on 11/11/2021, and this showed that there was cerebral tonsillar ectopia, and the cerebellum and brainstem were normal, and there was mild descent of cerebral tonsil, and also the bilateral cerebral hemispheres were normal. So in this way, the patient, you can see the MRI. So there is it is directly impression. You can see that there was cerebral tonsillar ectopia, which relieved the symptom of diplopia. So this is the patient's verdict. So it is my YouTube channel. You just have to type Dr. Shamsa Fayaz and you will get this video. So in this way, the therapies which are explained ancients ago still hold successful even in present times. So Ayurveda is the cure for many of the ailments which are not treated in modern science. So that's why that is my humble request to approach to Ayurveda for different problems. So thank you for patient listening.